Good morning, one and all. I am Dr. Rekha Upadhyay, lecturer in the Department of Oral and Maxillofacial Pathology and Microbiology in the Dental College. Today I am taking the topic on permanent maxillary lateral incisor. Maxillary incisors are total two in number. Mesial side they contact with maxillary central incisors and distally they have contact with maxillary canine. Their function is supplements central incisors in their functions, and anatomically they are similar to the maxillary central incisors also. So their function is shearing or cutting the food. They also help in speech and provide support to the lips. Tooth numbering system. In the universal system, number 7 is given to the right sided maxillary lateral incisor and 10 number is given to the left sided maxillary lateral incisors. In the Zygmundi-Palmer system, 2 number is given. If the quadrant is open toward the right side, then it is right sided, and if it is open toward the left side, then it is left sided maxillary lateral incisor. In the FDI system, 1 2 is given for the right one and 2 2 is given to the left sided maxillary lateral incisors. Chronology. The first evidence of calcifications occurs at the age of 10 to 12 months. Enamel is completed at the age of 4 to 5 years. Eruption occurs at the age of 8 to 9 years, where the root is completed at the age of 11 years. Dimensions. The cervico-incisal length of the crown is 9 mm. Length of the root is 13 mm. Mesodistal diameter of crown is 6.5 mm, where the mesodistal diameter of crown at the cervix is 5 mm. Labiolingual diameter of crown is 6 mm and labiolingual diameter of crown at the cervix is 5 mm. Curvature of cervical line mesially is 3 mm and curvature of cervical line distally is 2 mm. So this is the cervico-incisor length of the crown. This is length of the root. This is mesodistal diameter of the crown, and this is mesodistal diameter of crown at the cervix. This is labiolingual diameter, and this is labiolingual diameter of crown at the cervix. Now, it can be described in different aspects. The first aspect is labial aspect. The crown outline from the labial aspect is trapezoidal and the labial surface is convex, and this convexity is comparatively more than the central incisor. The mesial margin is approximately similar to the central incisor, except that the mesoincisal angle is here not sharp, it is rounded. Height of the mesial margin is near the junction of incisor and middle third, where the mesial contact present. The distal margin is more rounded than the maxillary central incisor and also shorter. This is trapezoidal shape. This is mesial outline which is straight, and this is distal outline which is rounded. And this is height of the mesial margins near the junction of incisal and middle. The mesoincisal and distal-incisal angles are both rounded here in comparison to the central incisor, where the mesial one is sharp, where the distal incisal angle is rounded. Height of the contour of distal margin is present at the center of the middle third. The incisal outline is here not straight, it is slant, and slant is towards the distal side. Crest of the curvature of labial surface is present on the cervical third. Here the crest of curvature is present. This is mesoincisal angle which is rounded, but whereas in the center it is sharp. This is distal incisal angle which is more rounded than the maxillary central incisor. Lingual aspect. The lingual side shows convergence because the proximal surface converges towards the lingually. Therefore, the lingual surface is shorter than the labial surface. The mesial margin is more convex than the central incisor, and distal margin is also more rounded than the maxillary central incisor. Lingual fossa is comparatively deep and it is V-shaped, whereas in the center it is W-shaped, and it occupies almost 2/3 part of the lingual surface of the crown. The cingulum is limited to the cervical third, and it is comparatively more prominent than the maxillary central incisor. This is lingual fossa, which mesial margin is curved and which mesial margin is straight and distal margin is curved. This is cervical line, which is semicircular in shape and directed toward the root apex. There is a lingual pit which is present at the junction of V and a lingogingival groove present which emerges from the lingual pit and crossing the distal side of the cingulum and extending on the root for a varying distance. Marginal ridges and cingulum are comparatively more prominent than the maxillary central incisors. The mesial marginal ridge is straight, where the distal margin ridge is comparatively shorter and curved, and root is also narrower than the labial aspect. Mesial aspect. The mesial aspect is very similar to the central incisor but has comparatively lesser dimensions. The labial outline is convex, but it is comparatively less convex than the maxillary central incisor, and lingual outline is S-shaped and it is similar to the maxillary central incisor. Curvature of the cervical line is marked in the direction of incisal edge, but it is slightly lesser than the central incisor. The contact area on the mesial aspect is present at the junction of the incisal and middle third, which is similar to the contact area of central incisor. This is the mesial contact area. This is curvature of cervical line. From this aspect, incisal portion of the crown appears thicker than the maxillary central incisor. Incisal outline is formed by incisal edge, and this incisal edge is rounded. Root appears cone-shaped and it is evenly tapered from cervical line to the root apex, which is comparatively blunt. If a line is drawn through the center of the root, then it tends to bisect the incisal edge of the crown and root apex. So when we draw a line, then this bisect root and crown both in the center. This is the distal contact area. Distal aspect, distal surface is comparatively smaller and more convex in all the dimensions than the mesial surface, and crown appears slightly thicker from the distal aspect than the mesial side. Curvature of the cervical line is usually 1 millimeter less than present on the mesial side. It is only 2 mm. Proximal contact, it is present at the middle third, where mesially it is present at the junction of incisor and middle third. Incisal aspect resembles central incisor, that is triangular in outline, sometimes more or less ovoid in form. Cingulum may be large, and mesodistal diameter is slightly more than the labiolingual diameter. This is mesodistal diameter and this is labiolingual diameter. Exhibit more convexity both labially and lingually at cervical third from incisal aspect than the maxillary central incisor. Mesiolabial and distolabial line angles are comparatively more rounded than the maxillary central incisor. Lobe of the labial surface are less clearly demarcated in the lateral incisor because of high degree of convexity. So here lobes cannot be easily seen. Root, the lateral incisor has a single and wider single root which is wider labiolingually than mesodistally. In comparison to the central incisor, the root is longer in relation to the crown length, but the actual length of the root is same as the central incisor, or sometimes it may be shorter than the central incisor. The apex is relatively sharper than the central incisor, and the apical third may be deflected, and if it is deflected, mostly it is towards the distal side. In both cervical and mid-root cross-section, the outline is roughly ovoid, wider labiolingually than mesodistal. Thank you.